Hello everyone, thank you for joining us today. We're here with Dr. Mandy Smiton of Dr. Mandy and Associates, and who is a clinical psychologist specializing in working with children. And one of Mandy's favorite passions is working with children in neurodiversity and the field of neurodiversity. Why is this such a passion for you, Mandy?
Oh, that's a good question. Do you know, I met my first child who had autism, which is kind of one of the conditions we would consider as being neurodiverse, when I was a trainee clinical psychologist quite a few years ago now. And there was just something about working with a child this child happened to be non-verbal, so kind of at the different end to where I tend to work now. I just found it absolutely fascinating. And my first job after I qualified was working half in the generic child adolescent mental health team and half in a team specialising in children with social communication difficulties, so children with autism. And it just went from there. I just got really interested and really loved working with these families, and it can be really, really challenging and tough at times, and when you can go in and make a difference, it's really rewarding. And one of the things I really like about working privately with families is that I'm able to see them for as long as is helpful to them. So it's not like they have to see a different person every time they come. They've got a relationship with me, and I know them, I know the background, and it's been amazing to have some of my clients, who I've seen since they were quite little, and then I've got some who have just got places at university, and that's really lovely to see how much they grow and develop, and how much they can thrive. So so yeah, fascinating area.
Wow, I love that continuity from little to spreading their wings and growing into their bodies and minds, as they all do, but also that you're there to support them and the family in that process.
Yeah, it's
All those
amazing.
butterflies. I'm feeling emotional today. It's quite a grey day. And so warning here. Yeah, there's something in the air at the moment, I think, as well, in the kind of universal consciousness about we are doing very well in the UK with our vaccination programs.
Yeah,
Have you had both of yours now?
I have. Yes, I'm very
Yes.
lucky as a healthcare worker and seeing clients face to face. I've been able to have both now, which feels safer for
Yes.
everybody that I'm seeing.
Yes.
So that's good, and
Yeah.
yeah, it's good to do your bit and do what we can to try and keep going in the right direction.
Just so lucky, aren't we? I had my first one this weekend, and
Yeah,
I was a bit nervous, and although
yeah,
I kept on saying to myself, I'm really grateful and optimistic and about
absolutely.
this. So yeah,
Mm.
so that's good. And our children have all gone back to school not
Yes,
that long
yeah.
ago, right? So a
No, and
few
then a
weeks
break
ago.
for the Easter holidays, which
Yeah.
I think was really tricky timing. They'd
Yes.
literally just gone back for, I think, was it 3 weeks, and then
Yes.
another break again, which I think has been quite disruptive for some of the
Yeah.
children that I've seen. They've not had a chance to kind of get into the swing and get used to everything again. So,
Right.
but yeah, they have hopefully got a bit more of a run up now until the half-term holiday and chance to
Yes.
get
There's a
back
few
into
more
things.
weeks. And
Yeah.
so has that changed the kind of what you're seeing in your practice, or the children that you've been seeing? Are they feeling more challenged or more sensitive? What are you seeing right now?
Um, Actually, I think this time round, the return to school, we've not seen as much of the anxiety about going back to school, because I think in some ways, they've been there, they've done it before, they've had
Mm,
time out of school. If,
mm,
there's been a COVID case, and they've all had to come out to isolate for a couple of weeks. So I've seen less of that. We do seem to be getting a lot of inquiries around eating disorders, which isn't something that we treat in clinic, because we work as lone clinicians, and that's something that really needs a team approach.
right.
So we've had a lot of inquiries for that, though, and I know from the national data that eating disorders have really increased in the last year.
Wow.
We're seeing a lot more tics and Tourettes actually as well, because interestingly there has been a huge increase, particularly in adolescent girls, who perhaps have never had any tics before but are suddenly presenting with really quite severe onset of tics. So we're getting more inquiries around that. That's something that I work a lot in, and that's part of the neurodiversity branch, you know, the brain working a bit differently. And actually what I've been seeing in the last month or so is a lot more from families in terms of, I guess, what we would call challenging behaviour from primary school age children. So quite a lot of anger and aggression, and, you know, refusal to do what they're asked, and, you know, difficulty complying generally. So there seems to have been a real ramping up of that. I mean, you know, that's just what I'm seeing from our little clinic in the corner of Oxfordshire, but
Yes.
that's certainly what the sort of picture that we've had, and also a huge increase. So last month was something like 40% more inquiries than we would normally get, so a significant amount more. And I think that's probably partly because there is more difficulty around, but I know as well that it's really difficult for families to access the local CAMHS teams, the Child and Adolescent Mental Health Service, because they're all really snowed under after the last year, and obviously lots of things having to be delayed because of the lockdowns. So I think families are increasingly looking for support in the private sector, because, you know, they want to get things moving, they want to change things. So so that's difficult. Interestingly as well, actually, I've had a lot of inquiries for autism assessments, ADHD assessments, dyslexia. I do the autism and ADHD with a private clinic, the Oxford ADHD and Autism Centre. I do assessments there with them. We don't assess for dyslexia. But I think what's happened is that a lot of families during the last year have obviously been having to homeschool their children, and they've observed a lot of the challenges that the children have, and the challenges they've had in trying to homeschool. And I think that's making families then reach out to say, oh, hang on a minute, you know, I think there might be something more going on here, and we need some support. So that's the kind of picture I've been seeing in the last little while.
Right. I mean, there's so much there, isn't there? Just from challenging behaviour to parents noticing and having the opportunity to notice that their children struggle, and wondering what they can do about it to support them. Tics, Tourettes, symptoms flaring in adolescent girls, and eating disorders. With the eating disorders, I know you don't treat in particular, and I'm assuming that by the time that people are able to reach out and get some help, they may be at an acute phase. So you can't help. Who could, just for the parents who might be worried?
Yeah, no, absolutely. I mean, the best thing to do first of all is to go to the GP, because they will be able to do physical checks, you know, check things like height and weight, and take blood tests to check for deficiencies. And actually, even though CAMHS are really overwhelmed, eating disorders is the area where they do intervene quickly, because it is so risky and so dangerous. So absolutely, you know, if parents are worried, it's good to go and get some help sooner rather than later, because the earlier you intervene with these things, the better it's going to be.
And things have changed, haven't they? Sorry, what were you going to say?
When people are kind of really reducing their calorie intake, it creates lots of changes in how the brain functions, and they can get more and more rigid, and then it gets more and more difficult to treat because of how their brain is then working. So it's really important if parents are seeing that a child is really restricting what they're eating, or doing things like weighing their food, or weighing themselves more than once a week, or if they seem to be exercising excessively, then obviously that's a good time to go and get help. And I think one of the real challenges, and again, it's not my area at all, but one of the real challenges that people with eating disorders generally don't want the help. They don't want to change things because they know that the help is going to mean that they're going to have to eat more. So it's a really tough area, really difficult area, and that's why it needs a whole team of people to support families with that, because it's complex and potentially really, really risky. So
okay, so GP is the first port of call.
GP is the first port of call
with that, and don't leave it. If you're worried, don't leave it.
Absolutely.
So with you know, with neurodiversity and challenging behaviour, I'm assuming that challenging behaviour is normal in children.
It is normal in all children
typical.
to some extent, absolutely.
It's typical of all children and desirable. Because you know, we that's how they learn, right? By pushing boundaries, and you know, challenging behavior is challenging behavior that challenges us.
Yes, that's the important bit. It's who's it challenging, and it challenges us as parents. Probably not the child.
Probably not the child. So when I know this is just such a wide topic, and it's difficult without possibly having a child in front of us, but I'm to the parents who are going, oh, I'm struggling with this, I don't understand this, none of my usual tools in my toolbox, you know, are working, I can't get my head around this child. These are all things that I have felt, my husband and I have felt at different points in our children's journeys. So you know, perhaps what are the questions that a parent could be asking themselves as a checklist to go through of, is this kind of part of human development, of child development? Is it me? Am I really challenged? Or is this something in my child that I need to investigate further?
Yeah, no, that's all good questions. And I suppose just to sort of summarize about what we mean by neurodiversity as well. So it's a term that seems to be used a lot more these days, and I think is generally well accepted within the neurodiverse community from what I hear from families. So when we're talking about neurodiversity, we're talking about any difference compared to the norm in terms of brain functioning. So we're thinking about conditions such as the autistic spectrum, ADHD, tics and Tourettes, dyslexia, dyspraxia, anything which is, it's not caused by the environment, if you like. It's about how the brain is wired from birth in order to create some of the challenges that come along with some of those conditions. And I think it's important to say that, you know, not everybody has challenging behaviour. We do see it, and obviously because of my job, I only really see the ones who are challenging. So it's not unusual for children with autism and ADHD to present with challenging behaviour at times. And that's because often as part of the conditions, there is a low frustration tolerance, so they can get frustrated quite easily, and there can be difficulties with what we call emotion regulation, that ability to manage your emotions and calm yourself. So that's why we tend to see a bit more challenging behaviour. And I guess in terms of challenging behaviour, that can be a really broad range. A really large part of my caseload is working with children and parents where there are really high levels of anger and aggression, or maybe that, you know, just not complying, not doing what parents ask. So that I think can be really, really challenging for parents to deal with, particularly if it's day in, day out. And what can often happen as well is that they're not seeing that in school. And so I think one of the difficulties is that parents then often blame themselves, and unfortunately I see lots and lots of families where they are blamed by other people as well. You know, the school effectively are saying, well, they're fine at school, so must be you. Or, you know, or they might have seen other professionals in the past who've sort of said, oh, you know, no, it's your parenting. And actually, when I talk to some families and go through the history, sometimes it's really clear that actually we're seeing a bit more here than you know, a child who needs better parenting. We're seeing a child
Mm-hmm.
who is perhaps neurodiverse and therefore needs a different understanding, and parents need the toolkit then to parent in a different way. And again, not because they're doing it wrong, but they're probably just parenting in the way that they were parented,
Yeah.
or in the way that they've read is a good way to parent, or in the way that perhaps works for their neurotypical children, you know,
Yeah.
the children we call, you know, normal,
Yeah.
you know, the ones who do not have some kind of neurodiversity.
Yes.
And what we know is parenting in a neurotypical way for a child who is neurodiverse doesn't usually work very well, or, you know, can
Yeah.
create real difficulties. Of course, for some children it's fine, but
Yes.
for a lot of the children that we see who are presenting at that clinical level, they need something different.
Yeah.
And that's the kind of work that then I can do to help them understand what the differences are, how their brain is working in a different way, and therefore how they can do things differently, so that things are easier for the child and therefore the whole family.
And yes, I mean, I was smiling because, you know, one of our children, our third child, has been completely different than the others in terms of how she has needed to be parented and how we have wanted to parent her. And, you know, we were just at such a loss and felt all of the things that you've said, as, you know, and, you know, ask the school, you know, school are like, no, you know, cue the expected meltdown at the school gate or before going into school, holding it together in school, and then utterly falling apart, which is something that I also, you know, hear from lots of the parents that I work with, is, you know, the school don't see it, and you just feel so
really
weird as a parent, and actually, to be honest, like a complete failure, because you're like, it must be me then, something that I'm doing. And actually what we've found is that the children are holding it together in school, working so hard, like, you know, like, I don't know if you were going to have a continuum, like working 20%, 25% harder to hold it together in school, and then by the time they're literally coming out, they have no more left to give.
Can't do it anymore.
The pressure cooker goes. So you know, it took us a while to go, okay, we need some help. And you know, all the books that we've read are kind of pointing to certain tool sets that, you know, we need some help with, and some help aligning our parenting both with a child and together.
Yes.
So is that something that you see quite frequently, as parents coming in going, actually help us?
Oh yes, huge amounts, absolutely. And sometimes I do a good chunk of work with the parents first, and that sometimes is enough. And depending on the child's age and whether the parents want the child to have some individual work or not, and whether we feel it's appropriate, sometimes it will just be about supporting the parents, and that's not because they're bad parents or doing things wrong. It's just that they need a different way of doing it, and a different toolkit, and as you say, sometimes just lining up a little bit more, because I think for any child, neurodiverse or not, it's very difficult if you've got two very different parents, or two parents parenting in very different ways. That's really confusing for a child. They don't know which way up. So bringing that closer together can be one of the things that can help.
My husband and I call it the wedge. The children are very good at finding the wedge between
they are excellent at doing that.
So I just wonder if there is is there always a need for a diagnosis?
Yeah, no, that's a really good question. I think I'm really pragmatic about it, and I think diagnosis is helpful if it's going to change something. And there's lots of potential areas that it could change things. So one is for the parents. So, you know, parents can scrap all their normal parenting books that they've had on the shelf, and they can read about parenting a child with ASD, autistic spectrum disorder, or ADHD, and find a different way of doing things that's probably going to work more effectively. So that's one thing. And I think I do sometimes see parents who are also viewing the child as naughty, or bad, or, you know, quite see them in quite negative terms, and actually to be able to say, well, no, their brain just works a bit differently, and the reason that they're doing X is because of this, I think can be really helpful to then change the way they see things. So I think that's one of the reasons why it's helpful. It can be helpful for schools as well.
Yes.
So again, schools have, a toolkit that they know, right, for children who have this particular diagnosis, these are the supports that we can put in place for them. So if there is a formal diagnosis, then it allows school to be able to do that. Schools can do these things anyway. Some schools I work with are really good at sort of saying, okay, we're seeing traits, there isn't a diagnosis, and there's a long wait for a diagnosis, but let's put things in place in the meantime. And there's no reason why schools can't do that if it's not going to cost anything, if it's sort of something that can naturally fit into the school day. And I think really importantly, the third reason is about the child and how they understand themselves, because again, I often see children who have quite low self-esteem and maybe view themselves as bad or naughty, and actually helping them to understand that their brain just works a bit differently, which means some stuff's tough, some stuff like emotion regulation is really difficult, or maintaining friendships is tough, but they've got a great brain because they're able to do lots of other things really well. And I think them having that understanding is really helpful and really powerful for throughout their lives. And I think what we often see is, I guess, the other end. So we often have teenagers coming into clinic with perhaps anxiety, depression, self-harm, maybe emerging eating disorders. And when we look at their history, we can see that there's probably some neurodiversity that's not been picked up because it's not obvious enough. And they've done that kind of, that holding it together all day, every day at school, desperately trying to fit in or desperately trying to conform. And it gets to the point where they can't keep doing it, in teenage years. It's harder. It's a lot harder, relationships get complicated, the demands increase in terms of the academics and the expectations of organisation, and that is sometimes when the wheels can fall off. So I see primary school age, earlier diagnosis is also potentially being preventative of some difficulties further down the line. If you've got a child who everybody just understands how they work differently, then I think that can be really helpful.
And also, I suppose there's that, by the time, I've got teenagers, we've got teenagers, and I've got a child still in primary school, and from what I'm seeing is, and from my own practice, it's really helpful to get used to talking to someone, or having somebody in a support role with who the children trust and can talk about their feelings to, possibly other than their mum or dad. Because there might be a time where they need it, and it doesn't come easily to us as adults. But wouldn't it be lovely if it came more naturally, and if we were encouraged to do it? So I know lots of schools have ALSA support in place, or pastoral lead, or counsellors even. I wish there were more. There's Senkos, just a trusted person who they can talk to about their feelings, and that those feelings just don't just get bottled up, I suppose, is really helpful thing to start. So that was a bit of a sidetrack, because it just popped in my head, is wouldn't it be great if children left primary school knowing they can talk about their feelings honestly, and they had adults around them who modeled that? And
I think we're getting better at that. I think there's probably still a lot that we can do, and I think one of the positives of the last year is that there's so much talk about mental health generally now, and I think people are being much more open about it. People are talking about their own experiences. It's not got the stigma that it had, certainly when I started training. I remember there was still quite a lot of stigma around it, but it's getting better. I think there's still a long way to go. It can still get better. But I think it's so important that we talk about emotional well-being for all children, particularly given the last year and how tough it's been for so many. It's interesting what you say about having a space to talk about feelings, and I think you know, because I work with a lot of children on the autism spectrum, often the last thing they want to do is sit in a room and talk about feelings
Yes.
with me or with
Yes.
anybody. You know,
Yes.
often for a lot of them, they don't like talking to parents about how they feel, let
Yes.
alone talking to somebody else. So I think that's one of the potential barriers, and something that I work really hard to engage the child so that they do feel okay talking about it, because it can be really difficult. And roughly about 50% of young people with autism have something called alexithymia, which is it's basically a difficulty in recognizing and understanding your own emotions. So a lot of children won't know, a lot of children with autism won't know and recognize that they're starting to feel stressed. And therefore, how can they do anything about it if they don't know what they're feeling and why they're feeling it? How on earth can they expect to manage it? So I think, coming back to the idea of challenging behavior, usually underneath that there is some kind of feeling that we need to understand and work on together. I'd say the vast majority of the time it's anxiety and stress, and it's an underlying anxiety and stress that perhaps they don't know and recognize, that might not be obvious to other people. And I think understanding that is really important, and what's creating that anxiety and stress, because then we can look at changing those factors, removing them if possible, and that then reduces the challenging behavior that you see. So if I give you an example.
Yes, please.
So you know, I have quite a lot of children who, for example, struggle in the morning getting ready for school.
Yeah.
And it can start from the beginning, in terms of they've got the anticipation of going to school all day. So if you've got a child with autism going to school for sort of 6 hours a day, where you're surrounded by people, you've got to interact with your peers, you might not know what's happening, you might not know what to expect during the day, there might be changes during the day, it might be noisy, there might be lots of things going on. So a lot of children, just starting the day, they're already, you know, they're kind of, their cup is already full of stress before the day is even started. Then they might have to put on their uniform, and they might not like how their socks feel because of sensory issues, or how their shirt feels. So already you've got that kind of level of stress going on there. But what parents might see is the child refusing to get their socks on, refusing to brush their teeth, refusing to get ready. But actually, when we look at it and understand what's going on, it really changes then how we deal with it. Because I think for any of us, if you've got somebody angry in front of you, our natural human reaction is to kind of get angry too and feel angry, isn't it? That's kind of an instinct. Whereas if you understand that the child isn't really angry, actually they're really stressed out, or they're feeling really anxious, or it's a sensory thing, then you deal with it in a very different way. So I think that's where having a potential diagnosis, and even without a diagnosis, just the understanding, I think can really change things for families.
Wow. Yeah. I mean, yes. Are you talking, just when you talk about anxiety, that's a really, really helpful example. Just to be a bit clear, so are you talking about an anxiety that is intrinsically linked with these conditions because of adrenaline in the body, kind of a hormonal anxiety, an anxiety that is just in the body, and we neurodiverse people will carry most of it? Or is it in response to environmental, or is that like the chicken and the egg?
No, that's a really good question. So I think particularly for children on the autistic spectrum, we know that I think, I can't remember the statistic off the top of my head, but it's something like 80% plus of people on the autistic spectrum suffer with some kind of anxiety. So it's really, really prevalent. And in terms of the environment, when you look at all the potential things that can create anxiety, it makes sense given the challenges that people have on the spectrum. So if you have difficulties with interacting with people, and you've got to go to school to interact with people all day, that's going to make you anxious. You know, I'm really anxious around spiders. If someone said, right, you've got to spend the next 6 hours with spiders, I'd be feeling really anxious. Yeah, exactly.
And snakes for me.
Yeah, exactly. You know, we've all got those things. So there are things within the environment that absolutely can make the anxieties worse. But from a biological level, what we know from some studies is that the amygdala in the brain, the bit of the brain that controls that fight or flight response, some studies have shown that there are more neurons, more brain cells in that part of the brain for children on the autistic spectrum. So it's kind of a bigger area. So it's kind of more ready to fire off, if you like. It's more ready to go, oh, fight or flight, danger, you know, get out, run away, fight, whatever you can. And the difficulty as well for children on the spectrum is that the connections to the front bit of the brain, which is the bit of the brain that says, okay, hang on, let's make some decisions here. Let's do some judgment about the situation and make some rational, logical steps about the way forward. Those connections between the amygdala and the front bit of the brain aren't so good in children with autism.
Right.
And so that's why you can often get, you know, very quick reactions to, you know, can you put your socks on, please? Can you brush your teeth? You know, you might see a huge explosion, which doesn't seem to fit with the task they've been asked to do. And without them having the time to process it and kind of think through, well, hang on, do you know what? I'm going to have to get my socks on because I get them on every day for school. So I may as well just do it. You know, those connections just don't often work so well. But the good news is that actually through therapy that can change, and actually you can kind of, children can learn to understand themselves again, understand their triggers, understand the anxieties that they have, understand how it feels in their body, and of course then learn how to manage things. So it can be a bit of a two-pronged approach between helping the child to understand and manage their emotions, but also about helping with parents and school to say, well, what can we do to change the environment and how things run so that the child isn't struggling so much with all these things.
And the neuroplasticity of the brain is
it's
a
marvelous.
big factor, right? It is marvelous. It is marvelous.
And what we understand about it is, you know, so tiny.
Yeah, so tiny. I was talking to a nutritionist the other day, and she was talking about how you know, whose special subject is neurodiversity and nutrition, and how about the way that certain nutrients are absorbed in the body may differ, and also that the behaviors differ because of the way that those nutrients are absorbed. It's another question altogether. So who would parents contact at the moment? What do you advise for parents who are worried, who are seeing these you know, challenging behavior, and for whom this interview has been interesting, or Chatterview rather, has been interesting, and are thinking really resonating with everything you're saying for their child?
Yeah, no, absolutely. I mean, I think it's helpful to talk to schools to find out, you know, are they seeing any differences in school? You know, does the child seem any different to usual? I think, you know, it's important to think as well about, is this something that is very new in the last year, which again, I mean, the last year has seen so much change, so much uncertainty, so much stress, so much loss for children. You know, the loss of seeing friends, the loss of seeing extended family, the loss of all their usual activities, that it's really understandable if children have been struggling. You know, it's been hard for so many people for so many reasons that, you know, I think it's looking at, is it a new thing, or actually sometimes when parents look back, they can think, actually, do you know what, it's actually been really tough for a really long time, but it's perhaps exacerbated by the last year. So I think, you know, certainly talking to schools to see if they've seen any differences in terms of how the child is there, if they have any concerns about the child. As you said, you know, there are in some schools lots of people who can provide support as well, like ELSAs, you know, pastoral care workers. So it may be that they can provide some emotional support in school. I'm sure they're busy in schools as well with
they are
demand. But you know, that's a good start to find out a little bit more about that. Obviously there's the GP that they can go and see as well if they are really concerned about their child, and if they're thinking that they need some support as parents, or if they are thinking that they need some sort of diagnostic assessment. And again, schools can support that. For diagnosis, we always get information from parents, but we always get information from school as well. So are saying, actually, yes, we can see some issues here, that's helpful, because then it's all sort of pointing in the same direction.
Right.
So they're really, really good starting points. Obviously, if parents have already got a diagnosis, there's some really good support around locally. So within Berkshire, there's the Berkshire Autistic Society.
Yeah.
Within Oxfordshire, there's quite a lot, but Autism Family Support is one of the organisations that provides brilliant support, or more broadly, the National Autistic Society as well. And there's a really good organisation in Berkshire called Parenting Special Children that does all sorts of really good workshops, obviously all online at the moment, and training days, and helps parents who are either waiting a diagnosis, because we know that the waits are very long at the moment, or who have a diagnosis and want help with specific issues. So they often look at specific things like sleep or challenging behaviour or anxiety. So they're really good resources as well. I think that's the good thing these days. There is a lot of information out there, but you don't always know where to go if you don't know, well, is this ADHD, or is this autism, or is this normal? That can then be difficult to know which direction to go in. But obviously they can seek professional support as well if that's possible for them, to just find out a little bit more about, should I be worried about this?
And CAMS, can you directly go down the neurodiversity? I think that they have a neurodiversity branch, is it? Or
there's a neuro pathway within Oxfordshire, and I think in Berkshire as well. And there is a screening process, because obviously they have to make sure that they're going down the right route. But within Oxfordshire, families can self-refer. I'm not sure about in Berkshire at the moment, if that's possible as well. But again, often GPs can refer for you, or sometimes schools can refer in as well. And again, if the school are saying, oh, actually, yes, we've got issues, we need help, that in some ways helps a little bit more to kind of add weight to the referral. But like all services, they are unfortunately stretched, and the waits are really long for diagnosis at the moment, unfortunately. Within Oxfordshire for autism, I believe it's 2-3+ years.
So don't wait. Don't wait.
If
you change your mind,
if you're even
somebody else will be grateful for your place eventually. Thank you so much. If you I could just talk to you all day. Do you have a word or advice for parents who might be listening to us at this point?
I think, as we said last time, actually, I think something that's really important is about looking after yourself. I think if you do have a child who is challenging for whatever reason, be it because of a particular diagnosis or not, it's so important that you look after yourself, so that you've got the resources to be able to manage it. And there is support out there, so it's just getting support from school or from one of the voluntary organisations. I think there's something really powerful in being with other families as well, who know how your day goes, and who live the same sort of life as you. I think that's really, really helpful, to be able to have that support and know that you're not alone, because I think sometimes it can feel quite isolating if you've got a really challenging child. And of course, it can be really tricky as well to have respite. If you've got a child who is really difficult with their behaviour, then grandparents might not want to look after them, or might not be able to. So it can be really, really tough for parents. So I think looking after yourself as best as you can is always a good piece of advice.
Yes, absolutely. Thank you so much for
You're very welcome.
coming on today and being with us and giving us a word of your wisdom. Thank you for all the work you do with young people and families, and we think you're marvelous.
My pleasure.
I'll see you soon.
See you. Thanks a lot. Bye-bye.
Just stop the recording.